Hi, this is Sarah McLeod, your host for Proven Cures, and thank you for tuning in to part two of Cancer Cell Death by Soursop. In part two, I'm going to share a human subject study called The Remission of, doesn't have the at the beginning, it is simply Remission of Peripheral T-cell Lymphoma following a Graviola diet. This study was actually published, I call it the 4O journal. Let me tell you what the 4O stand for. Hold on one second. It was published in Oral Surgery, Oral Medicine, Oral Pathology, and Oral Radiology journal. December of 2014. You can find it in volume 118, issue 6, page E188. I'm being really specific as to the whereabouts of this study because I had such a hard time finding it. It was not necessarily readily available on PubMed.gov. I actually had to read through a bibliography of another study in order to find it. The research was conducted at the University San Sebastian in Santiago, Chile. University Mayor, it was conducted at three different institutions. University Mayor in Santiago, Chile, and Fundación Arturo López Pérez in Santiago, Chile. The publishers are C. Martinez, B. Martinez, and M. Meneses. Okay? So that is the study. I'm actually not going to paraphrase too much. A lot of what is published or available for me, anyway, that I was able to find, it was just an abstract. And it's not a lot of information, so like I said, that's why I'm not going to paraphrase too much. It is actually a case study of an 89-year-old woman who presented to her doctor with 3 smooth surface nodules on the dorsum of the tongue, the buccal mucosa, and the back of the tongue. These nodules were present for 5 months at the time when she finally got to the doctor. The nodular mass on the dorsal surface of the tongue was approximately 4 centimeters in diameter. It was painful and was causing her difficulties for speaking and eating. The mass on the buccal surface was approximately 2 centimeters in diameter and asymptomatic, meaning there were no symptoms along with it other than its presence. Both nodules were similar in color to the surrounding mucosa, so it's not like they were black or brown or anything. They blended in with the rest of her mouth, but they were still large and very much present. The patient's medical history was significant for diabetes mellitus type 2, hypertension, and hypothyroidism. After biopsy, she had a biopsy done. Immunohistological studies of the 3 nodules showed, among other markers, CD3 positive and CD5, CD4, and CD8 partly positive for peripheral T-cell lymphoma. She, because of her age, refused to have chemotherapy. Instead, she was advised by a relative of hers to follow a Graviola diet. Now, the issue I have with this abstract, and the fact that I couldn't find any more information on it, was I have no idea how she consumed the Graviola. I don't know if she had the pulp of the fruit. Remember, Graviola is Soursop. Probably in Chile it's called guanabana. I don't know if it was the pulp of the fruit she was consuming, if she was eating the soursop, if she took the pulp and maybe made it into a shake or a drink of some type, which is another way of consuming it. It's actually very delicious. I don't know if it's the tea leaves she was brewing and drinking as a tea. I know that it is most effective if you get like 10 or 12 of the dry leaves and you brew it for about 10 minutes. You can drink it that way, and it allows like all of the antioxidant properties in the leaves to steep by leaving it for 10 minutes. So the study does not explain how she consumed it, nor how often, how many times per day. It simply says that after 14 months, no masses were identified by physical examination. And the patient referred that the nodules diminished their size after 6 weeks following the Graviola diet. And she was also able, after 6 weeks, to eat and speak normally. So, I would say if this is someone who, and this is just me now surmising, which is not necessarily what I'm telling you to do, but just using common sense, this is someone who she didn't get this advice from a physician. She got this advice from a family member. And if this was a tea that she was drinking, which is pretty likely, dried leaves are easy to get. She could have been having that with her meals 3 times a day. She could have been drinking the tea with her meals 3 times a day for 6 weeks, and she'd already gotten that much benefit from it. So that's the first human subject study I was able to find for you on Graviola and T-cell lymphoma. Part 3, I am going to share a study on Graviola and breast cancer. So yeah, tune into part 3 if you're interested in hearing about how Soursop affected one woman who had breast cancer, how it helped her. Okay, thanks.